Good afternoon, and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host, Dr. Loreena Ryder. We're here to help you navigate your journey to wellness. We like to do it simply without all of that horrible medical terminology that everybody hates. We like to help teach you how your body can heal itself using natural remedies. It's simple, it's natural, and it works. If you're still struggling with your health, come see us at Naturopathic Physicians Group to help get your life back.
So your topic of the day today, and this is Dr. Ryder, by the way, we are talking about iron, more specifically iron deficiency anemia, just because that's the most prevalent iron issue. And so we'll talk about what iron is. It's a mineral, and the body needs it for growth and development. And your body uses iron to make something called hemoglobin. That's a protein in red blood cells, carries oxygen from the lungs to all the parts of the body. Iron's also used to make myoglobin. That's a protein, and it provides oxygen to the muscles. Your body also needs iron to make some hormones and neurotransmitters as well.
Basically, without iron, you can't make red blood cells, which means you can't transport the oxygen. It's the easiest way to think about that. So if your system is low in oxygen, and I don't just mean breathing, I just mean in general, if your system is a very poor oxygen situation, you're going to be linked to chronic illness, diseases, increased risk of cancers, etc. So iron is one of the most essential things out there. Can't live without it. But if you take too much, you can't live with too much either. So it's really a delicate thing. So how much iron do you need?
Based on what the USDA and Health Canada tells us, there's an average daily recommended intake of iron, but it varies according to your age, according to your lifestyle, and your dietary restrictions. So let's take someone like me. I'm I have to say how old I am. I'm going to say mid-40s, female. So according to the chart, I need 18 milligrams of iron per day.
Yeah, and when you look at the chart, it is based on basically minimal needs. So this is to survive how much iron you need.
For perspective, you would need...
Am I a mid-50s male? No, I'm an upper 30s now.
Okay, so that would put you at 8 milligrams. So females, 18 milligrams, males, 8 at that age group.
Nice. I don't know how much iron I take a day.
It's a big difference.
I just eat healthy, and I know there's iron in my food.
Yeah.
But in general, just to give you a perspective, a cup of chopped chicken has 1.8 milligrams of iron. So if you needed 8 milligrams a day, I guess I got to eat, 5 cups of chopped chicken every day, if that's the only thing I'm eating? That sounds very undoable.
Yeah, but then if you take a look at steak, you've got a whole lot more iron in red meat. So there's 6 milligrams of iron in a cup of chopped steak.
And it's very common if somebody is high in iron, they might be eating way too much red meat, because that is a very common thing. And they end up making too many red blood cells, and then they have to go donate blood.
So if you have someone who is vegan or vegetarian, so just take a side salad, something without any meat in it. There's a small amount of iron also in some vegetables, but a side salad is going to have 1 milligram of iron in it, and that's going to depend on the salad as well. Now, I know this is everybody's favorite food, but when you take a look at liver, if you do even just half a cup of chopped liver, you have 15.2 milligrams of iron.
I totally made chopped liver for Halloween. Do you remember?
I do. I ate some of it.
Yeah, for Halloween this year, I did a Silence of the Lambs table, and I fed everybody brains.
I ate some of those too.
Liver, and I had a nice bottle of Chianti. And that's what we do for Halloween. So in general, yes, liver had, so I gave everybody their iron for 2 days, just if they had that appetizer.
Yeah.
See, I'm trying to, my parties, you got the normal Halloween stuff, but I'm still trying to keep you healthy.
Hey, they're healthy.
Minus the alcohol. Minus the Chianti. It was a nice bottle of Chianti, just Hannibal Lecter told me. So what conditions are associated with iron? Well, of course, there's different conditions, whether you're too high or too little. We're going to spend most of the time today talking about too little iron because it's way more prevalent to be low iron than it is to be high iron, and it's got a lot more treatment options associated with it as well. But again, the number one condition associated with too little iron is iron deficiency anemia. Anemia means low red blood cells. Like I said earlier, and what Dr. Ryder said earlier, you can't make the red blood cells without the iron, so if you don't have enough iron for a particular period of time, the amount of red blood cells in your body will decrease and you'll become anemic.
Yeah, this is most commonly seen in women. Why? Because women menstruate and they lose their iron whenever they menstruate. Also vegans and vegetarians because they don't eat meat where iron is most prevalent. Adolescents, seniors, pregnant women, infants, children, and athletes, they're all the demographics where this iron deficiency is most commonly seen.
And with vegans and vegetarians, they're often lacking other nutrients as well. So being a naturopathic physician, we see a lot of patients who want to be vegan or vegetarian. So we always curtail their supplement regimen to make sure that the things that they'd be lacking in their diet, they're going to be able to replicate. And so they can stay healthy and still have their morals of not eating animal products.
Something that a lot of people don't realize is that restless leg syndrome is associated with having too little iron. This is a condition that's secondary to that iron deficiency anemia. It's caused by some electrolyte deficiencies and dehydration as well. But when you lack that mineral of iron, it really does trickle down the line and cause other effects in the body.
You feel it. When you're at the point of anemia with iron, you can't hide it. Men can hide it a little bit better because they tend to have more iron storage in their system. But if a woman is low in iron, it's almost impossible to hide. They're going to feel miserable. And one of the biggest things they're going to feel is that fatigue. But how common is this? They say almost a third of the world's population can have iron deficiency anemia. Now, that gets skewed because it's way more common in the third world countries where they're not getting enough food in the process. So those third world countries are going to skew the data to having a lot more population. But even in America, even in the Western world, it's still a very common nutrient. It's probably the second most common nutrient people are deficient in. Number one would likely be vitamin D, and number two would be iron. And it's just extremely common. Most cases, women, children, as we were talking about earlier, but in general, up to a third of the world will have this condition.
Yeah, that's how important it is. It's very important.
Every single week I do a segment called What Isn't Your Doctor Telling You? This isn't an anti-doctor segment. It's just when you have your appointment with your doctor, oftentimes your questions just don't get answered because they give you about 3 minutes in the office. So I like to give a tidbit out there that you may or may not have heard before that may help you on your journey to health. Today, since we're talking about iron and particularly iron deficiency, one of the most common things prescribed for someone to be low in iron is, you guessed it,
Iron.
Iron. Pretty impressive, right? Your doctor never told you that, right? No, but the thing they don't tell you, though, is that the number one iron they give you out there is called ferrous sulfate, and that's the prescription form that you'll get in the actual pharmacy. And what they don't tell you about that is when they give you that one, it has a very common side effect of plugging you up. It makes you constipated. And so a lot of times people will take their iron and they'll feel a little bit better with regards to the deficiency, but then they can't go poop. So what they end up doing is they call their doctor and they say, hey, I'm constipated. Naturally, you would want to say, okay, let's switch your iron to a non-constipating form of iron. Nope, the conventional world does the opposite. They're like, oh, we'll give you a stool softener or a laxative for that. So now you're on 2 drugs for a simple deficiency of iron. So don't fall into that rabbit hole. They make lots of different forms of iron out there. And if you're getting constipated from your iron, you might want to talk to your doctor about a lesser plugging up form of iron.
Now, you had mentioned fatigue is going to be the biggest and most noticeable symptom. That's true. Beyond fatigue and just feeling like you absolutely can't get out of bed or can't get off the couch, or once you sit down, you can't get back up. If you notice that you're pale or having kind of a yellow or sallow skin, could be a sign of anemia. Shortness of breath or chest pain, especially with activity, unexplained, just generalized weakness. Iron deficiency can actually affect your heart too. You might have a rapid heartbeat or a pounding or whooshing in the ears. Headaches, that's kind of tough because headaches can be associated with a lot of things. Yeah. But headaches with activity specifically can be associated with iron deficiency anemia.
Yeah, it can even cause cravings. There's a thing out there called picophagia when you're craving ice. That can happen with iron deficiency. But basically, iron, again, it makes red blood cells. If you're not making enough red blood cells, all the conditions associated with your blood, which is pretty much everything, can be seen as a symptom with iron deficiency.
I just realized something. My mother had 7 children, okay? She chewed on
Poor
ice.
thing.
Yeah, like I'm thinking her ice chewing drove me batty. I'm thinking maybe she was iron deficient now.
Test her iron. Yeah, even some people complain about having like tongue swelling or soreness due to that. Your hair loss, brittle nails, because it's needed for the formation of the actual hair follicle, for the integrity of your nails, you need iron. So there's so many different things. And we touched a little bit about some of the common causes, but you can cause iron deficiency yourself. You don't eat properly if you don't get enough iron in the diet, but also people that donate blood a lot. Now, I'm a big advocate of blood donation out there. I've been a blood donor in my history many times, to the point to where they would call me every 12 weeks and annoy me to when I'm doing it again. It became so bad. They'd call me literally the second that I was due to donate again. I was donating like 3-4 times a year when at possible. The second I was available again, I got off a tangent again, but the second I'd be available again, they'd call me that same day, email me that same day. It became so frequent that they were calling me from 3 different numbers.
Wow.
I had to change my ringtone in my phone to when they would call me, it was Jaws.
Oh my gosh.
Because they were stealing my blood. No, but
do you have the blood type that they want? The O?
They want all blood types. They're going to call you. And again, big advocate of blood donation. I'm not complaining about it. It was just really annoying on how frequently they were calling me. But basically, if you donate too frequently, you can put yourself in anemia. This happens because one of the treatments of too much iron is blood donation. So these people think they need to donate all the time because they're too high. They can actually do the opposite and cause themselves to go deficient.
Another cause of iron deficiency anemia is just simply being a menstruating female. Think about it. You lose blood every month and you have iron in your red blood cells. There goes your iron. So that's why whenever we were saying earlier about how much iron do you need as a female, it's 10 milligrams more than an adult male. It's because you lose that every month and you have to replenish it. So that's something that's really important for females to realize.
Yeah, if you're a chronic nosebleeder, if you have any kind of GI issue, so if you have bleeding hemorrhoids or if you have a bleeding stomach ulcer, you can become anemic because of the amount of blood loss in there that you might not notice unless you are throwing up, or if you're actually looking at your poop. We're a big advocate about looking at your poop. We've said that many times. Most people don't do it, but you can learn a lot about your health when you look at your poop. South Park, I know I was talking about South Park, but South Park had a great episode where they're looking at the size of the poop, and Randy sees this and he thinks he's got the world record, so he's calling his whole family in to take a look at it. So really funny. But
world record.
It was, yeah. It's a great episode. But that being said, it's looking at your poop. It doesn't have to be about world record size. It's more about looking at it to see how is your digestive tract working. And if you see blood or undigested food or mucus in there, it could be a major sign. And if you see blood in there, you could become anemic if it's an undiagnosed condition.
Yeah, it's a leak, basically. You got to stop the leak, whatever leak is happening.
Plug it up.
Yep. Let's talk about too much iron. Now, this is less common, but it does exist. There's something called iron overload. It's also known as hemochromatosis. It's a condition in which your body stores too much iron. It can cause serious damage to your body, including to your heart, liver, pancreas. You can't really prevent this disease, but early diagnosis and treatment can avoid it. It can slow it down. It can reverse organ damage. Now, this is generally due to dietary intake by food or supplementation of getting too much iron, like you mentioned earlier. If somebody's eating a ton of red meat, their iron might be an overload.
So, iron overload, these are the patients that you're going to want to test regularly with their blood work, because if they have too much iron, you've got to treat that, and then they do the donation. But basically, if you're not testing the blood work regularly, you're not going to know if you get too low, and you're not going to know if you're maintaining too high, because if you store way too much iron for a long period of time, it can cause major damage in your system.
Yeah, there's also something called hereditary hemochromatosis, which that's the same thing. It's iron overload, but it's a genetic mutation. It's caused by a mutation in one of the genes that controls iron absorption from food in the digestive tract. And over time, that excess iron accumulates in the tissues throughout the body and leads to that iron overload.
Yeah, long-term iron overload can cause damage in the liver and actually cause cirrhosis. So it can destroy your liver. This happens with people that also get transfusions regularly if they have other conditions like thalassemia or sickle cell anemia, any type of anemia that involves transfusions. You can get damage to the liver, including too much iron.
Yeah, also chronic liver disease like hepatitis C, alcoholic liver disease, and you mentioned the cirrhosis. That's another reason where the iron overload might take place. Now, with hemochromatosis, that iron overload, symptoms usually start between the age of 30 to 60, but it can show up a little earlier. And those symptoms are almost similar to iron deficiency, but you'll feel fatigue as well. But then it differs a little bit beyond that. You might get brain fog, mood swings, depression, and anxiety. You can even experience some weight loss. That weakness component, that's the same as an iron deficiency. Some joint pain, especially in the fingers, erectile dysfunction, and irregular stopped or missed periods. Those are going to be early signs of iron overload.
Later signs, if this is a long-term issue, you can get a loss of libido with it. You'll start to notice you'll get a permanent tan. Now, this is not the good kind of tan like you're going to the beach and enjoying your time and getting a nice little coloration in your skin. This is a potentially permanent looking tan, but it's caused because of the iron getting into the skin.
Yeah.
Abdominal pain, swelling. Because of the liver damage, potentially it can cause you to go jaundice and potentially need a liver transplant if it gets bad enough. You'll feel thirsty, you'll get joint pain, achiness, chest pain, shortness of breath. Again, there's so many conditions, but think about it. Red blood cell issues are going to be problematic whether you have too much iron or not enough iron.
You can also experience some swelling in the hands and feet. And, I'm sure men won't like this one. If you have too much iron for too long, your testicles can get smaller. Now, that's important to note with somebody who has testosterone replacement therapy, because they must get their iron tested regularly because it can increase with that. So make sure you keep an eye on that.
So if you have testicle shrinkage, you have to make sure what's causing it. It's not always because of the testosterone.
You would know.
Fair enough.
Better than me.
What do you mean I would know?
It's because you have testicles. I don't, as far as I know.
I'm not going to go there.
There you go. And today we are talking about iron. Dr. Ryder here with your tip of the week. So let's talk about how you get iron into your system. You must eat it. Your iron is it's not made in your body.
When you pump iron, it doesn't magically get into your system.
Pumping iron. Is that Arnold Schwarzenegger?
I must be deficient.
But yeah, iron must be absorbed from what we eat. So there are two types of iron. There's heme iron and non-heme iron. Heme iron is found in red meat, poultry, and pork. And it is the type of iron that's most easily absorbed by your body. You absorb between 15 and 20% of the heme iron that you eat. Now, non-heme iron is found in plant-based foods, and that's fruits, vegetables, nuts. Foods with non-heme iron are definitely an important part of a well-balanced diet, but the iron in these foods won't be absorbed as completely. You only absorb between 2 and 10% of the non-heme iron as opposed to 15 to 35% of the heme iron. Now, that's where we get in trouble when it comes to vegans and vegetarians, because they're eating non-heme iron and you don't get as much absorption. So that's when you have to either supplement or just increase the most iron-rich non-heme foods possible.
That, or they have to supplement the iron from that standpoint in the supplementation. They do make vegan forms of iron where you can get enough milligrams of the iron. But again, if you take too much iron, it can be just as problematic. So the traditional testing you'll do for this, you're always going to run a CBC. If you're expecting iron deficiency, especially with anemia, or if you're expecting too much iron, you're going to run a CBC, because a CBC is a complete blood count. So it's going to be able to see your red blood cell function. It's also going to be able to see that hemoglobin and hematocrit, which is what the iron helps make in the red blood cells. So you'll be able to tell from your CBC what type of anemia or you have, if you do have a type of anemia. And there's certain things that you use when you look at that CBC to determine if you're suspecting a vitamin B12 or a folic acid deficiency causing anemia, or if you're suspecting an iron deficiency. And one of those is called RDW, which is also known as distribution width, or red blood cell distribution width. If you're high on that, which is shown on a CBC, it points you towards iron. Doesn't mean it's always iron, but it points you towards there. And if you also have MCV being low, which stands for mean corpuscle volume, basically it's the size of your red blood cells, because iron deficiency anemia means your red blood cells shrink, they get smaller. So if your MCV is low, it also will push you towards iron deficiency. Again, it's not a perfect science. There are plenty of people with low MCV that aren't iron deficiency, but it's the way you use it as a guide.
Yeah. Other traditional testing, you can check the actual iron that's floating around in your serum. That's always a smart idea. I get frustrated because I don't see that happen very often in traditional tests, but sometimes. Ferritin is something that's tested. That is the iron storage. And transferrin and TIBC, those are the movers and the shakers of the iron. And so it's important to know how iron is moving as well.
Yeah, if all you run is iron, you're missing too much.
Yeah.
Because again, there are people that, depending on the time of the month, if they're on their period, they might drop an iron during that time and replenish it when they're nowhere near their period. So it's not always a perfect cycle of measurement. So a lot of times people use ferritin as another way, because it is your iron storage, so you can actually see how your overall iron levels are doing. But that's also not an end-all be-all, because you can have elevated ferritin just because you have too much inflammation in your body. So you can't just see the ferritin and then assume you have iron excess if you have too much ferritin, or if you're low in ferritin doesn't necessarily mean you're iron deficient.
Yeah, if you haven't figured it out by now, lab tests can be quite confusing, and it's an investigative work to figure out what's going on.
And when you go on WebMD or Google Doc or whatever thing and you look up, oh, I have high ferritin. Oh, well, they're going to tell you that you're dying.
Yeah, pretty much.
So don't always do that.
If your iron is low, then your traditional doc might run some secondary tests to determine if there's a bleed in the GI tract, which is what you had talked about before, or even in the urinary tract. So your traditional doc might order something like a colonoscopy or an endoscopy just to rule out that there's anything going on there, that the leak might be there. Or they can easily check a urinalysis in the office if the patient has chronic UTIs to see if the bleeding is coming from there. And if those are negative, then likely you'll just get referred to a hematologist, which is a doctor who specializes in blood pathology.
So traditional treatments that they do for iron, again, eating iron is your preferred way. It's usually the best way to do it. However, as we've learned from, or as we've talked about many times, a lot of the foods out there in the world are not good quality foods. So oftentimes a conventional doctor will tell you, go eat more foods that contain iron. So then you look up what foods contain iron, and you get a bunch of foods that are fortified. So fortified foods are basically when they pasteurize or process your product, they lose all those nutrients. So then they have to re-add those nutrients back into the food. And iron is one of those fortified nutrients. So as you can assume, if they're adding things back in, they're going to try and make it the most cost-efficient way possible. So in your processed foods to make them cheap, therefore they're going to add the cheapest, crappiest forms of iron to those fortified foods. So you might be getting more iron in there, but the amount of absorption you're getting there is going to be pretty poor, as well as you're going to likely be seeing the ones that are more harmful to your system or more constipating and more side effect oriented.
And these are going to be foods like your breakfast cereals, breads, fruit juices, yogurt. Margarine. Oh, that is just an awful thing.
Which is basically plastic.
Yeah. Snack bars, even baby food and baby formula. They have to meet their limited requirements of the amount of iron in there. But yeah, it's junk iron.
And even when we say bread, that also means gluten-free bread. When we say milk, that also means milk substitutes. And a perfect example is when you go read the package of almond milk, which is one of the most common substitutes people use that want to be dairy-free, they say added vitamin D and they say added calcium on a lot of them. And they're going to say added iron on some of them. But the vitamin D they put in there is vitamin D2, which is the worst form of human vitamin D you can get. It's not even human vitamin D. So it's like they're putting cheap junk in there. So even though it says, oh, you're getting 60% of your daily value of vitamin D in a serving, if they're giving you crappy versions that you're not absorbing well, you're not really getting your 60% daily value.
Now, you had mentioned iron by prescription earlier. So their prescription iron is called ferrous sulfate, and that's the one that you said you got to be careful of because it can cause constipation. Very true. There's also another prescription iron called ferric citrate, and this iron, it might cause your stools to turn black, but it is a harmless effect. Might be fun for Halloween, but it likely has been prescribed by your traditional doctor because the benefit to you is greater than the risk of the side effects of being low in iron.
Yeah, I take the healthy irons when I need it throughout the year, but in October I always take the ferric citrate just to make sure my stools turn black. No, I'm just kidding.
No, you use activated charcoal for that.
I use activated charcoal to turn your poop black. God, if anybody likes to make scary foods out there, you should invest in activated charcoal. Not only can you detox your friends and family when they're coming over, you can make some wicked, cool, scary foods.
Turn your teeth black, have a good time.
Yeah, it scares a lot of people too. And then, but yeah, you're detoxing too. Again, my parties, they're a lot of fun, and then we detox you at the same time.
If your insurance company would approve an iron IV, your traditional medical doctor might prescribe this for you if your labs are low enough that you would need that. And in a worst case scenario, your doctor might even prescribe a blood transfusion. Now, you would have to be pretty much have passed out in the hospital and your levels are so very low physiologically, that's the only answer.
Yeah, and side effects of way too much iron if you end up taking too much, because it does put people in the hospital, which is why we always tell people, we never tell you what to do. We just give information out there. But iron supplementation puts people in the hospital, so be very careful. But other side effects of iron supplements can be upset stomach, nausea, diarrhea. People can faint, constipation like we talked about. It's not just clean fun and games.
Yeah. So if you feel like you're just not getting to the bottom of your health issues with your current doctor, give us a call, Naturopathic Physicians Group, 480-451-6161. We're also on the web, naturopathicgroup.com. I'm Dr. Loreena Ryder alongside my co-host, Dr. Stephen Katz. We are here to discuss different topics on health and natural ways to treat them. And today we're talking about iron.
So now we're going to jump right into naturopathic treatment options. So if your iron is too high, there are food and drinks out there that can help you reduce your body's ability to absorb the iron. So one of the things out there is soy protein. Soy protein allows the body to reduce the absorption. That being said, there's a lot of bad forms of soy out there too, so we're not advocating go eat a bunch of soy if you have too much iron. Most of the foods and drinks that lower iron are going to lower you a little bit. They're not going to be taking you from a toxic overload back into normal functioning iron. We're talking about borderline. It can help lower things. So tea, coffee, wine, they contain a constituent called tannins that reduce iron absorption because it binds to the iron and then it allows the body to process it through. And avoid berries and chocolate because they can also reduce the iron absorption by up to 60%.
So if you take a look at that on the other end of it, so if you are someone who runs low on iron, you want to avoid these because that's just one more way that iron is not being absorbed into your body. And then obviously, blood donation, you talked about this before. I actually deter menstruating women from donating blood because naturally they are donating blood every single month. So let's talk about some iron-rich foods. Like I said earlier, you must eat your iron. We cannot produce it within our body. We have to eat it and absorb it from our food. One of the best, absolute best foods is blackstrap molasses. Now, the molasses has to be blackstrap. It's a special type. And in each tablespoon of blackstrap molasses is 2.3 milligrams of iron, and it has an absorption rate from 50 to 97%.
That's huge.
It is. That's the same amount of iron that's in a third to half of a steak.
Do you like molasses?
I love it. Now, it does taste weird
See,
to some
I
people.
like the taste.
Do you?
See, I've used it before in some recipes. Instead of using something like sugar or
Yeah.
something like that, you can use of course, changes it drastically. It's not going to be nearly as sweet,
Yeah.
but it'll have a lot more health components to it as well.
Yeah. So if you dislike the taste of licorice, then you probably will not like blackstrap molasses. Also, if you have diabetes, it's probably not going to be a good idea for you to be using this.
Animal proteins are going to be your highest source most of the time compared to the plant-based ones. So chicken, liver, beef, turkey. We already talked about a lot of these. Some fish like tuna and halibut, crab, clam, shrimp. A lot of iron in there too. The most common source is going to be from beef or liver. They're going to have your highest amounts too. So when people tend to get too much iron from their diet, it's generally due to either they're taking a supplement and they're on way too high of a dose or don't need the supplement, or they're eating a lot of beef, a lot of liver, stuff like that.
If it has a muscle and you're eating that muscle, it has iron in it. So pretty much that's the rule. But let's talk about liver. That's good.
Either.
Beef liver and lamb liver is one of the best sources of B12 of any food. And B12, we talked about that earlier. It goes hand in hand with iron, B9, all of that. So let's talk about liver, though. Whenever you're purchasing liver to increase your iron, it is the organ in the animal that detoxifies, right? That's what our liver does for us. It's what it does for the animal. So does that mean the liver that you buy might contain toxins?
Yes.
Very possible, yes. So when you purchase a liver, be picky. If you're a hunter, the deer liver should be clean. If you purchase from a local farmer or a butcher, it's better than conventional store-bought. Grass-fed beef is always a better option. But if you are buying conventional, I would recommend purchasing calf liver. They're young, and they would not have spent a lifetime processing toxins.
And if you're going to do plant-based forms, the highest iron levels you're going to see are going to be oatmeal, lentils, soybean, tofu, leafy greens. Spinach has iron, raisins. And again, be careful on the fortified foods because you're getting the worst form of it out there. But seeds, pumpkin seeds, sesame seeds, you already talked about molasses. Some dried fruits like dates and apricots will have iron in them as well. So there's definitely ways to get it as a vegan, but you're way more likely to become deficient as a vegan versus somebody who eats meat.
And if you're trying to increase your iron absorption, make sure you eat something that is vitamin C rich with each iron-rich meal. It actually helps increase your iron absorption. And that's going to be like your citrus fruits, kiwi, strawberries, cantaloupes, bell peppers, broccoli, those types of things. So if you have a nice, beautiful salad with a steak on top, be sure to throw some mandarin oranges or yellow peppers or something on there to help increase the absorption.
So what about with cooking? You were telling me earlier about a lucky iron fish. I'd never heard of this before. So what's a lucky iron fish?
This little guy, not only is he adorable, but he's really great with helping you get some iron absorption. So the company, if you just Google lucky iron fish, it'll pop up. It's a Canadian company. And it's a cast iron fish, and you drop it in your soups or whatever you're making a big pot of, and it will release 6 to 8 milligrams of iron per use. And it's reusable. So you take it out, you dry it off, you can coat it with oil if you want to, but it's not necessary, and keep it until the next time you make a big pot of soup or something.
So why do they call it lucky?
Unknown.
Homework. Now, cooking with cast iron skillets, when you cook in a cast iron, it will increase the iron content into your food up to about 16%. And the food can actually absorb up to 6 milligrams of iron per 100 grams of foods. You definitely increase the iron content when you use cast iron. There's so many different pots and pans out now there too, so you got to be pretty careful. They have so many that are aluminum, not so good. They have so many out there that are copper. I'm not telling you which is wrong, but a lot of these metals and stuff, you do too much of that, it could be harmful as well. So just got to be careful what you're using. Make sure you're not eating all of the raw materials that you're cooking with.
And if one of your kids or your husband accidentally throws a cast iron skillet in the dishwasher and it gets all rusty, do not throw it away. That thing can be saved and used again.
Sweet. Save money.
Yeah. Let's talk about supplements. So elemental iron is something that you'll want to take a look for on oral iron supplements. When you choose a supplement, be sure to check the label to see how much elemental iron it contains. A greater amount of elemental iron means that your body will absorb more iron.
You're going to have some that are called food grade vitamins, and those food grade, and again, we're never telling you to go out and buy a bunch of supplements. Again, people end up in the hospital from taking iron. So again, this is something you will talk with your doctor before ever trying, and of course, check your blood work before ever trying to make sure it's safe for you. But food grade vitamins mean that they're getting the iron from a food source. So they won't always tell you the type of iron in there other than the fact that they got it from food. So it might just say on the label iron. But what you want to know is what type of iron most of the time. So when you look at stuff, we already talked about ferrous sulfate, which is the prescription one, where that one's linked to causing constipation. It's more toxic. Its absorption is lower. It's just not a great form of it. But they also make stuff out there like iron glycinate. Iron glycinate is a type of iron which absorbs a lot better. It's less toxic. It has a much higher efficiency in the system and doesn't have all the GI symptoms associated with it. So that's nice. They also have ferrous bisglycinate, which is another form of it, where there's studies out there that show that it improved the hemoglobin concentration without all the GI problems of the prescriptions. So again, there's definitely other forms out there.
Yeah, iron aspartate, iron fumarate, and iron succinate. Those are all like glycinate. They're better absorbed, and there's a lot less side effects.
They make a liquid one called ferrous gluconate, highly available source of iron. Liquids traditionally absorb better than tablets or capsules, but again, the quality, the other ingredients in there make a big difference. And if you're really low and you need a IV of iron, again, this is done in a doctor's office, very protected, and making sure that you have your blood work to make sure this is safe for you, because if you do iron too fast, you do too much iron, you will end up in a hospital. So if your iron, your ferritin, your red blood cells, your hemoglobin, your hematocrit is all in the tank, sometimes supplements are not strong enough and you need an infusion. So thank you for tuning in to Your Health is Wealth. We're here to help you take charge of your own health and increase your quality of life and support your natural healing processes.